Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our Hospital System General Director. Today is Thursday, August 5th, giving you the update from Albany Med. All right, Fred, let's jump into the numbers. First graph here. Let's look at New York State. These are admissions to the hospitals of New York State with COVID. And you see that's at 852. So trending up.
Definitely.
Trending up.
Yep.
That's a theme we'll have here. Here's the capital region. We're currently at 54. Now, at one point, we were as low as 5. 5.
And that was less than 4 weeks ago.
Right. So we're watching that very carefully.
Very carefully.
Next graph here, let's look at inside Albany Medical Center's admissions and discharges. If you look here, Fred, you can see we had a period about 2 weeks ago where we're going a couple days in a row without admissions.
That's right,
It was
Dennis.
either 1 or 0.
Right.
We were kind of having some fun with that.
That's right.
The binary. We're now back to 2, 3, 4 admissions on some days
That's
over the
right.
last week or so. So what does that mean inside here at the medical center? So this graph here shows that we currently have 14. Let's break down those numbers a couple different ways. We have 11 adults and we have 3 peds. Fred, you wanted to talk about the peds a little bit.
Yeah, Dennis. So in the last 2 weeks, we've actually seen 8 children under the age of 15, 7 of them under the age of 12. Now, fortunately, they've all done well.
Right.
I think 6 of them have already been discharged
Right.
from the hospital. But it's definitely a different pattern than we experienced back in January and
No
February.
question about it. No question about it. Another way to break down that 14, Fred, is of the 14 who are in the hospital right now, 13 are on the floor, 1 in the ICU, and that person is on a ventilator.
That's right.
So,
just the other day went on a ventilator.
all right, very good. And then lastly, Fred, in the last 7 days, some people come in, they're in for a day or 2 and they're discharged. Some people come in, and if they're really sick, they stay for weeks.
That's right.
In the last 7 days, we had 15 brought into the hospital. Of those, can you give us a breakdown on how many of them were fully vaccinated?
None, Dennis.
None.
None of them were fully vaccinated. They were all unvaccinated individuals.
Fred, another question people will often stop me in the hall and ask is, they'll say, I saw your video. How many of those are the Delta variant? And obviously, you and I know the answer to that, which is that we don't always know. But to talk a little bit about how often we test for the Delta variant.
So first of all, nationally, Dennis, you know this, the Delta variant is the dominant variant. In New York State, the same thing. Now, we send samples from Albany Medical Center to the Wadsworth Laboratory, and we do that particularly when the cycle time is very short. So the amount of time it takes to identify the virus in the sample. And there's a little bit of delay, so we don't know real time. But the most recent data we have, the majority of samples coming from the capital region and now from Albany Medical Center are Delta.
So to talk about that a little bit more, in the last week, 15 people got admitted. They tested positive for COVID.
Correct.
Some of those could be Delta. If you had Delta, you would test positive. We just don't know what strain it is until we send it over to Wadsworth.
That's right. And we don't send every
Right.
sample over. It's a subset of the population that we see.
All right, very good. Good breakdown. Fred, a couple more numbers. Let's talk about vaccine efforts in the capital region. Some good news. We've now crested over 700,000 who've been vaccinated. If you look at those 18 and above who have received at least 1 shot, Fred, we're currently at 75.5%, so that's great news.
Tremendous.
Interesting here when you look at hospital workers. So if you go to the website, capitalregionvax.org, they'll give you a breakdown by age. They'll give you a breakdown by gender, by race. They also break it down by hospital workers. In New York State, hospital workers are at 72%. Capital region's at 88%. So that's good, but we definitely want those hospital workers to be at 100%, obviously.
Absolutely. Very important, Dennis.
Fred, I'll turn it over to you for length of stay.
So let's pop up the length of stay graph. You can see that we've ticked up a little bit in the last several days. Dennis, we're working really hard on moving people through the system appropriately. As we always say, it's in their best interest, it's in their health interests to get them to the next venue of care. We have a lot going on in the institution that potentially gets in the way of that, and we're also encumbered by what's happening outside. So transportation, as an example, recently has become a problem when people need to be transported to a nursing home or elsewhere for their next level of care. So something very important for us to continue to focus on and try to keep those length of stay numbers down.
No question. Constant effort. Let's shift gears. Let's talk about some other fun topics. First of all, Fred, Workforce Challenge, which is the annual race. It's back again this year. I think last year they didn't have it. I've run it many times in the past. It's lots of fun. Albany Med's going to be forming a team. I think we have a captain.
We do, Steve Jones.
Yes.
And he has done that repeatedly in the past.
Steve does a great job.
It's a 5K, about 5K run.
Right.
So that's really good. Sign up if you want to be on the team. Sign up is by Friday.
Yes.
So look for that, and please join if you want to do this.
Yep. 5K is 3.1 miles for those who don't know that. I think people can walk it if they want,
Yeah,
jog
absolutely.
it, run it.
Absolutely.
We have T-shirts for those who sign up, and our very talented Lori Hansen.
Lori
once again.
Hansen. And we haven't seen them, but we hear that there's a very catchy phrase on
Yes.
them.
Moving forward
Work
together.
together.
Right. So we'll move forward together as a
Absolutely.
workforce running the Workforce Challenge.
It's really great.
Another thing, Fred, very important to you and me, blood donation. So another blood drive next week.
Next week, Tuesday the 10th, from 7 to 3 in F309.
Yes.
Dennis and I will be there at 7 a.m.
Yes.
Please join us.
Yes, we're going to give blood.
We're going to give blood. We'll show a little bit of that on
Maybe
the
we will.
video next week, maybe. But really, really important. There's still a shortage nationally and regionally. It's a critical component of the care that we provide here at the medical center.
Always very valuable, obviously during the trauma season in particular. Lastly, Fred, one of the great things about working at Albany Med for 20 plus years is there are colleagues that we work with who, when I was in training here as a resident, they were faculty, and they're still here, and they're just so incredible to us, and they're so important to us. And one of those icons is Dr. Tom Smith, right? Pulmonary critical care physician, brilliant man, and he was recently featured in something for the NIH, the National Institutes of Health.
Yes, Dennis. So Tom has been involved with a system called the Zephyr RX, and that was featured in the National Heart, Lung, and Blood Institute website. And this is kind of a really cool thing.
It is cool.
It's a way for patients to improve their lung function using a video game.
Right.
And so Tom's been involved in this, I think, for a couple of years
Yes.
now. And so he's been featured in this NIH publication. So congratulations, Tom. Good job.
Congratulations, Dr. Tom Smith, a fabulous teacher and somebody we're very proud to have here at Albany Med. So that'll do it, Fred. We're going to roll into the weekend, and we'll pick it up again next week.
That's right.
All right, very good. We ask that those who are working here this weekend, we thank you for what you do to keep us running 24/7. We'll be back again next week. We ask that you once again please take care of yourself, take care of each other, and we'll see you next week.